A lot of people ask how to bend the suction for optimum use. What you want to do is you want to do a soft bend. So what I use is I use the back of my thumb to guide my bend, and then I have my first bend, and then I do a second bend and twist. So I'm not putting a kink in my suction, but I'm creating an L with the suction so I can hang it on the patient's cheek. Now sometimes it will make that slurping noise, so you can also take the end of your suction and tip it up so it's away from the cheek or the patient. So instead of straight like this, it's tipped up. What you want to avoid is a sharp bend, which is noisy and also ineffective. Okay, to place the suction in the mouth, you're going to start by a soft bend, and then you're going to bend again and twist like so, and then place in the patient's mouth. Sometimes it will make the slurpy sound, so I take the end, tip it up, and it will be up here like that. I also use my suction a lot to retract, so I just use one large soft bend. I'm going to show you where to place the suction for each quad. So I'm going to start with just one large soft bend. For quad 1, I just place it in the patient's right cheek, and oftentimes I'll extend that soft bend so it will go further into the vestibule here, and I'll hold it with my finger, have the patient turn away from me, retract, and instrument. For quad 2, a similar situation, but I'm going to do the bend that I showed you earlier, the soft bend and the twist, and I'm going to place this up into the vestibule here. For quad 3, similar, but I'm going to make sure I do that last little bend so it doesn't get caught on the tissue, on the buccal tissue. In quad 4, I swing it around, and I'm going to have to do a backwards bend and hang it here. Make sure if you're using the suction to retract that you do have a fulcrum so you don't exhaust the muscles in your hand and arm.